The integrated acute care scenario will assess the student's ability to do several things. Mainly, perform a rapid focused history, recognise the severity of illness and escalate care early, perform a structured A to E assessment whilst initiating life-saving treatment. The students need to manage tasks, prescribe accurately, ask for and interpret any investigations, and finally make a rational differential diagnosis and management plan. At the start of the examination, in order to facilitate the station to run well, it's important that you discuss amongst yourselves the roles that you will all play. The main interaction will be between the student and the nurse. This ensures that each student has a similar experience. One examiner will provide the patient voice, and one examiner will provide advice when required and will later attend the patient and take handover from the student. When the buzzer sounds, the student will enter the room, confirm the student's name and explain the scenario to them. Check the student's understanding before commencing. Also, explain the roles that each of you will have and the role of the nurse, and advise them that they should direct their questioning and discussion with the nurse. If the scenario is not moving forward and the student is spending too much time gaining a history, the nurse should encourage the student to move on by giving relevant hints. For example, "I'm very concerned about this patient. He looks unwell." These prompts should be continued to be given until the scenario moves forward.
Okay, so let's just check what roles we're doing through the scenario. So I'm going to give the candidate their briefing and be the senior referral when they ask for help.
Okay. I'll be the patient voice and observe the candidate performance.
Okay, and I'm going to be the nurse, and I'll hand over, I'll do all the obs that the student asks for and anything the student asks for, and I will provide the obs that are not on the monitor.
Excellent. Okay. Hi, can I just check your name?
Yes, Val McDowell.
Hi Val, I'm Alistair and this is Fiona. We're your assessors for the station, and this is Barbara and she's going to be your nurse that's going to help you through.
Okay.
I'm going to read you through the scenario and then I'll ask you just to repeat it back to me to make sure that you've got it, okay? So this is Carla Jones. Carla's 25 and she's been referred from the acute admissions unit with shortness of breath. You're an FY1 on the unit and have been sent to assessor and institute initial investigations and management. There's an admission unit nurse with the patient who can perform appropriate tasks if you ask her.
Okay.
Okay, do you want to repeat that back to me just now?
So it's Carla Jones, she's 25 and she's come into combined assessment?
Yeah, the admissions unit.
With shortness of breath. How long has she had that for?
So that Carla will be able to tell you.
Oh, right, okay, sorry. I'm the FY1 and I have just to go and see her, and Barbara will help me out with any obs or anything.
Yeah, that's right.
Okay.
Okay, do you want to see to Carla for me just now?
Hello, Carla.
Hi.
Hi, Carla. My name's Val. I'm one of the doctors here. Can you tell me how you're feeling?
Really short of breath.
You look as if you're struggling a wee bit there. Barbara, could I possibly have a SATS probe on her, please? Yep. Carla, have you ever had anything like this before?
Yeah. Asthma.
You've got asthma, and are you on any medicines for that?
Inhalers.
What?
The blue and the brown one.
A blue and a brown one, okay.
SATs are coming up at 92, 93.
Okay, that's not so good. Barb, can you put on some high flow oxygen 15 litres
Okay.
with a non-rebreathe
Okay.
mask? Thanks, Stu.
Yeah, you need to prescribe that for me.
And could you do me a favour, once you've done that, could you just check her respiratory rate and her pulse and blood pressure for me, if that's okay? Right. The student may wish to give the patient some oxygen. The nurse will give the oxygen to the patient but ask the student to prescribe it appropriately on the prescription chart. As an examiner, you may check this after the prescription has been written. What was her respiratory rate? I mean, it looks quite fast.
Okay, it's at 25.
25, okay.
The pulse is 122.
Thank you.
Quite
Have you
fast.
got a stethoscope and you can just have a listen to her chest, please? To ensure continuity with the scenario, the nurse will give the student all the observations and any relevant clinical information as the scenario unfolds. For example, the nurse will give the results of the auscultation, capillary refill time, etc.
Widespread wheeze throughout when you're listening.
Okay. Okay, so her just chest expansion.
It's symmetrical.
Is it shallow or
Shallow.
and any accessory muscles?
Yeah, just using chronometer.
Okay. She's very wheezy in her chest.
Yeah.
So I think I'll prescribe her some salbutamol.
Okay.
I'm not going to do a peak flow because she can barely speak to me.
Yes.
Carla, are you allergic to any medicines that you know of?
No, I don't think so.
Okay, and have you've been taking your nebulizers at home? Has that got any better?
Just,
Have they
just the
helped?
puffers.
Okay, have they helped at all?
Not today.
Not
No.
today. Okay. So 5 milligrams of salbutamol and
Okay.
500 micrograms of epitopium,
Okay.
please. And we'll just drive it through oxygen because she's quite hypoxic anyway.
You're prescribing that, yeah?
I will do. And would you be able to get me a gas as well?
Yeah, I'll do
please?
that. Blood pressure's 107 on 57.
Okay. Carla, sorry, are you allergic to anything? Did I ask that?
Yes. No.
Okay, Carla, I'm just going to do
Oh.
check. I'll let you BG. Just going to check your blood, your oxygen levels. Okay, sharp scratch. That's it done. Okay, that's just off analysing just now.
Perfect, thank you. So that's her salbutamol and her epitopium.
Okay.
Ladies. So, having a wee think out loud. Queasy, actually. How does she feel, Bugs?
She's really quite cool.
She's quite cool.
Okay, I'm just going to switch over masks. Okay, you're going to get your salbutamol through an nebulizer this time. Okay.
At the appropriate time, when any results are available, please hand these to the students. If the student does not verbalise the results of, for example, the EBG or the ECG, then ask them what it shows. Okay, so, right, she's quite hypoxic. She's got PO2 of 8. Was this on the 15 litres?
Yeah.
And her CO2 is 4.7, which isn't great considering she's got a respiratory of 25, 26. Babs, I'm going to phone for some help now because I don't think I can look after her very well. Would you be able to do me a favour? Could you put in a cannula, please?
Yes.
And apart from your asthma, Carla, do you have any other medical problems? No. Okay. And are you on any other medicines apart from your puffers?
No.
Could I have a full blood count, a U's and E's, and a glucose, please?
Okay.
And I think, given the fact that she's, her blood pressure's, it's okay for someone her age, but the fact that she's asthmatic and breathing so fast, she's been unwell, I'll maybe give some fluids, but I'll prescribe that once you've got the cannula.
Okay.
I'm going to phone for help
Okay.
first.
I'll get the cannula.
To my registrar, medical reg. When the student decides it's time to call for help, they should state who they want to call. The call should be structured and relevant. Please take the information from them and tell them that you will be there, but you're unable to come at the moment and to continue assessing the patient. The students should advise you that they are concerned about the patient, and the handover or the call for advice should be in a relevant format.
Okay, so do you want to speak to me as if you're phoning the medical registrar just now? So, hi, it's Alistair, I'm the medical registrar on today.
Hi, my name's Val. I'm one of the FY1s in the assessment unit. I'm phoning for some help, please. I have a 25-year-old lady who's just been admitted with shortness of breath. She's known to be asthmatic, and she's coming in. She's tachypneic. She's got widespread wheeze, and her PO2 on 15 inches of oxygen is 8, but her PCO2 is 4.7.
Okay.
So I've given her some nebulizers, and I'm just really concerned that she's not very well. Would you be able to?
Yeah, she doesn't sound very well at all. I'll be about 5 minutes or so. Is that okay to come and see her?
Okay.
Grand. So if you wouldn't mind just continuing to look after her just now, and I'll be down as soon as I can.
Okay.
Okay.
It's about Reggie's coming in about 5 minutes.
Okay.
So
I've got the cannula in.
perfect. I'll order. Can we maybe get a portable chest X-ray
Okay.
and an ECG? Might be
Okay.
quite good as well. And I'll just prescribe her 500 mils of saline.
Okay,
We just get that running through as soon as.
Okay, fine.
There may be some patient information available to the student in the form of a GP letter or an A&E sheet or a ward continuation sheet. If the student is struggling and has not picked up on this, the nurse may direct them to this availability.
Is this her GP letter?
Yeah, that's it.
Okay. I'm trying to find it. Are those nebulizers helping at all? No. Okay. I've asked one of my senior doctors to come and have a wee look at you just now, okay? So hopefully we'll get that sorted out. 2 ICU admissions in the past and recent course of steroids. Carla, did the steroids help at all?
Don't think so.
Okay. Perhaps I might give her some IV hydrocortisone,
Okay.
and I'll give her IV because she's struggling. So she doesn't look very well there.
If the student struggles with a prescription, they may check the BNF. They may struggle to find the relevant page. This is something you might wish to discuss in your examiner briefing. It's all right to give them the page number, but please do not tell the students the dose. If the prescription is wrong, the nurse will query it with the student.
So I give her 200 milligrams of hydrocortisone.
Okay.
If I prescribe that, would you be able to put some just cardiac monitoring on, and maybe give me a capillary refill time, please? The GP says she's been unwell. Can I maybe get a temperature on her as well?
That's fine.
Thank you.
Again, you may check the prescription at this point. It should be filled out appropriately with all the relevant boxes filled in. It should be legible. If there are any issues, get your nurse to raise these.
Okay, so I'm just going to recap.
36.5.
565. So airways fine. Breathing I'm really concerned about. Sats are still
Flat 92.
92. I've given her some salbutamol and some ibuprofen, and that's still going. We can always give her some more salbutamol
Okay.
and do that back to back. I think that's where the issue is. Circulatory wise, she still feels
Oh yeah, I'll just
quite
check her. I'm
cold.
just going to have a bit of pressure on your chest. 5 seconds.
5 seconds, and she feels cold anyway. and blood pressure. Maybe get another blood pressure for me as well. But I mean, we can maybe after that fluids run through and see if it's helped. Disability. She's eyes are closed now. I'm really speaking. She can't speak in sentences, so I'm really concerned about her. Did I ask for a BM?
I did one, yes. It
Oh,
was
thank you.
4.8.
And I've got a temperature as well. I mean, one final thing, I'll maybe just have a look to see if I'm missing anything. Carla, I'm just going to have a wee look at your legs here and your tummy just to make sure there's no rashes or anything. And any pain in your calves there at all?
No.
Okay, so calves make me feel nice and soft. And any pain in your tummy?
No.
Okay, so E, I think, is everything else. I've got that GP letter. I suppose we could get some notes from ICU, but I can't think of anything else.
When the student finishes their assessment, you may come as help at this point. Prompt the student to tell you what has happened since the call and ask them some questions to assess their understanding of the patient's condition. You may also ask them what additional treatment or help may be required.
Okay, so at this point your senior help has arrived. So, hi Val, I'm Alistair, I'm the medical registrar on
Hi.
today. Is this Carla that you told me about?
Yes.
Okay.
So, obviously I told you on the phone that, well, she's an asthmatic. She's come in, she's been unwell for the past few days and she's come in with increasing shortness of breath. I've given her some salbutamol and some ipratropium nebulizers, but it doesn't seem to be making any difference at the moment.
Okay.
I've also, GP's given her a recent course of steroids. I've given her 200 milligrams of IV hydrocortisone and we've got some fluid running just now. Cardiovascularly, she's tachycardic and she's peripherally shut down.
Okay.
I'm just really concerned about her.
So what do you think is going on with her at the moment?
I think she's certainly having an exacerbation of her asthma.
Okay. And how severe do you think that is?
I think she's probably at the moment sitting on the kind of acute severe, but given the fact that she's had 2 ICU admissions in the past, I'm worried that she might end up kind of tipping over.
Do you think she needs to go to critical care at the moment?
I don't think it'll be far off,
Okay.
and I think certainly it would be helpful if they came to see her.
Yeah, that's fine. I can phone them and ask them to come and see her as well.
Okay.
Is there anything else that you could think about treating her with at the moment?
Certainly we could think about some aminophylline or some magnesium, but I'm not really sure of the doses of those.
Okay.
On completion of the scenario, thank the student and tell them that the station is finished and that they may leave the room. At this point, both examiners should independently grade the student and complete the mark sheet with comments.